I am pleased to inform you that starting tomorrow morning at 8:00 a.m., AHS will open booking to all remaining birth years in Phase 2A. The booking tool will be offline for 30 minutes from 7:30 to 8:00 a.m. to prepare. And after that, again, all eligible Albertans in Phase 2A can make appointments. As well, participating pharmacies continue to book appointments for everyone born in 1956 or earlier. I would also like to remind Albertans that once you are eligible, you stay eligible. So whether you became eligible last week or last month, you can continue to book your appointment if you have not already done so, as we proceed through our rollout. Turning to today's update. Over the last 24 hours, we have identified 505 new cases of COVID-19 and completed about 10,900 tests. Our positivity rate currently stands at 4.8%. We have identified 91 new cases of the variant of concern, which represent about 12% of our active cases. One of the things that we've heard from many Albertans is how much the absence of social interaction, in-person social interaction, has impacted them. And as we have always done, we've been looking at the impacts of COVID-19 and the impacts of restrictions. So I think one of the things that is currently important to consider is if there was a framework that minimized the number of people or minimized the risk to allow again, that risk mitigated type of interaction to happen, whether that would actually be better than the current state, because in some ways, perhaps the current state is causing people to feel that they just can't follow the rules anymore, that the pressure of isolation is becoming too much. And so again, we have to make sure that we're not thinking about the rules as an abstract thing that will always be followed, but rather as something that we want to work with Albertans to try to reduce the risk. The reality is that it is this very fact of most people having mild symptoms that makes COVID-19 so dangerous for our communities. This is because any one of us could be carrying the virus and not yet showing symptoms, passing it on to our friends and family, who then pass it on to others. If COVID-19 made most people who caught it extremely sick, this would make it much less likely to spread. As it actually behaves, it can spread like wildfire, and until we have enough vaccine to offer protection to the most vulnerable Albertans, widespread transmission would still mean surges in hospitalizations, ICU admissions, and even deaths. I don't ask Albertans to fear COVID-19. I ask us all to respect it. Many European countries are seeing a third wave in cases, hospitalization pressures, and deaths, despite being somewhat ahead of us with vaccine coverage in their populations. We are so close to having the ability to prevent these consequences with vaccine. I ask all of us not to waste the sacrifices that have been made in this past year by ignoring the public health measures in place that are still very much needed.